I think back to an example that Michael referenced earlier, leveraging telemedicine in those communities where there are not enough endocrinologists to provide that specialty support to the PCP. How can we connect those primary care docs to an endocrinologist? And we can use those virtual visits not just to connect patients to a doctor, but doctors to each other, and leverage the technology in very innovative ways.
So, we spent a lot of time earlier talking about the patient-centered medical home and different care models, team-based care, care coordination and such. I'm wondering if you have thoughts on some related topics, which you hear a lot about, the use of mobile technology and different ways of communicating with patients, with care teams. We hear about behavioral economics and incentives, and of course, Mark Fenderick, who's co-editor of the American Journal of Managed Care, is famous for value-based insurance design and thinking about, maybe in some cases we actually want to make drugs free out of pocket to patients because compliance will go up. Wondering if you're seeing, much of these things happening, sort of what might be called innovations, either using technology, using the science of behavioral science and economics, and the role that you might see that play going forward.
Yeah, I mean, I think all three of those things we see playing out in a variety of different areas. They're typically in small pilots where evidence suggests it's quite helpful. In the digital technology area, I think there's a lot of excitement about it. I think from my perspective, thinking of it as a standalone intervention that's going to make a difference is probably not the right way to think, but it's one tool as part of a broader engagement. And so, health coaching through that certainly can be effective. One thing that I think all of us as providers have done, even before the technology was available, was between visits getting glucose values and making adjustments in medication based on that. That now becomes so much simpler to do with a variety of technologies that can upload meters. The piece that has sort of lagged behind a little bit has been the sort of payment models to sort of incentivize that kind of activity, because typically it's been something we've all done just because we know it's the right thing to do, but and therefore it doesn't happen in the systematic way that it really could.
But back to your point, like at most managed care companies like WellCare, we have a mobile app for our members, and we can push disease-specific information through the mobile app. There's recent federal law changes around what we can text our members unless they opt into the programs. There's limitations on texting communication to cell phones, but nonetheless, we do offer that, say, for our high-risk pregnant moms who have diabetes or gestational diabetes. If they've opted in, we can text them disease-specific information about their diabetes and diabetes management. So both through the use of a mobile app and use of texting where the members have opted in, we have been able to leverage those technologies.
So do we have to worry about multiple messaging, too much information? We get texts from our providers, we get texts from our health plans. There's also, who patients may trust the most. I mean, it would seem to me that some degree of coordination, so, we don't want to overwhelm, sort of patients.
I think what we have to do is put as much resources into developing smart apps for individuals with illness, especially diabetes, as we do into developing drugs. And the drugs are developed because the reimbursement is so high, and the apps are kind of a nice add-on, but there's nothing to pay for it. We have to really say to ourselves, these are resources that will lead to more motivation, to less cost, and to ability of patients to understand their disease. And 3 or 4 years ago, I wrote an editorial for the Journal of Diabetes about this with Sam Dagagojak, who's president of ADA now. And we talked about how we look forward to this. And I must say, over the ensuing few years, I've been disappointed that we haven't seen the development of the kind of apps that will take the step counts on your cell phone and then take the medications and then so on, and then whip it all together in some way that'll help people do better.
I think I think you're absolutely right. I think the good news is that some of the big players in this space, Google, Apple, are really targeting this as a way to aggregate all the data that we have on our phones and elsewhere into a single source. I'm a little nervous about that being the full answer because I don't think it is. It'll be a nice tool. But a great example of where technology has really improved care is, for many of us that have patients, just simply giving them a continuous glucose monitor and they're able to see their blood sugars, they often will improve their diabetes just by having more information. Now, that's not universally true of every patient if you give them that, but certain ones will. And so similarly, as you're saying, if you had all of the data aggregated about, where you shop, where you walk, and, all of this is now available and could be aggregated, for a subset of society, it will drive, improvements.